Groote Schuur Hospital is famous for carrying out the first heart transplant by Christiaan Barnard in 1967. It was an event that galvanized the world of medicine and captured the imagination of the public, but it would not have happened without a brain-dead, consented donor. This is the intersection where the sequence of events unfolded that day. I pass it every day on my way to work. It was the 2nd of December 1967. Denise Darval, 25 years old, was crossing the road with her mother Myrtle, having bought a caramel cake from the Wrenchtown Bakery in Salt River. They were on their way to visit family friends in Milnerton. Her father Edward and her younger brother Keith, who was 14 years old, were waiting in the car. The drunk driver never saw them. They stepped out into the road at 3:40 p.m. Myrtle was hit and declared dead at the scene. Denise ended up in the gutter, bleeding from her mouth, her ears and her nose, with a severe head injury. The ambulance responded within 5 minutes and transported Denise the short distance up the road to Groote Schuur Hospital. On arrival, she was intubated, but despite maximum support, it became clear that she was brain dead. She was certified dead by 2 neurosurgeons at 9 p.m. on the evening of the 2nd of December. Her father had sent her brother Keith home with 2 cousins, while he waited on a hard wooden bench to hear news about his daughter. He'd already lost his wife. Doctors Kurt Venter and Bertie Bosman from the transplant team made the approach to Mr. Darval for consent. They sat the 66-year-old man down on a couch and gently broke the news that there was nothing more that could be done for Denise. Bosman explained that she could never regain consciousness despite the fact that her heart continued to beat. It was pumping inside an empty shell. His daughter was already dead. Bosman paused, allowing his words to be absorbed. "That's pretty hard luck," was Mr. Darval's response. Dr. Bosman went on to tell the story of a man in the hospital who was dying from a failing heart. The possibility existed for Denise to help another. It was too late for her, but this man could potentially be saved. Having made the request, Bosman and Venter withdrew, stressing that Mr. Darval should take as long as he needed to consider their request. They would understand fully if he declined to give consent. Apparently, all he could think about was how giving his daughter had been throughout her life. He took all of 4 minutes to make his decision, and he called the doctors back in. "If you can't save her life, save the life of this man." Denise was blood group O negative, the universal donor. Tissue typing also came back as a match. The transplant team began preparations. 2 operating theatres were prepared simultaneously, one for the donor and one for the recipient. It was 1 a.m. in the morning. At this time in the world, there was no worldwide consensus on brain death. Christiaan Barnard was aware of this lack of consensus from his time in America, where the issue was still being hotly discussed and debated. Despite having institutional ethical approval for the operation, and having ensured that the hospital's senior neurosurgeon, Peter Rose Innes, was part of the brain death certification, Christiaan Barnard also had the state medical examiner, or forensic pathologist, in theatre for the operation. The body of Denise Darval was on the operating table, cleaned and draped, when the ventilation was discontinued. The blood pressure fell steadily and the heart arrested. After 5 minutes of no activity on the electrocardiogram and an absence of any spontaneous respiratory movements, the medical examiner certified the patient dead by circulatory criteria. All accepted definitions of death were satisfied. Only then did the donor operation commence. A dose of heparin was given and the chest was rapidly opened. The patient was placed on pump oxygenator support and the heart was cooled. And the rest, as they say, is history. Louis Bashkansky lived for just 18 days, but he showed the world that heart transplantation was technically possible. Chris Barnard went on to become a household name and travel the world. His second patient, Philip Bleiberg, lived for 18 months. Patients 5 and 6 lived for 13 and 23 years respectively. Dirk van Zyl, the 6th patient, returned to work after 3 months and never missed a day of work for the next 15 years until his retirement. Not all cardiac transplant programs started as successfully, however. Dr. Adrian Kantrovitz performed a pediatric cardiac transplant 3 days after the South African operation at Maimonides Medical Center in Brooklyn, New York. But the patient demised 6 hours post-op. The patient had been 19 days old, born with a fatal congenital cardiac defect. The donor was born anencephalic, without a brain. Emotions ran high after this event, and there was much criticism professionally and in the media. There was an impression that the procedure was rushed, that cardiac transplantation was being used as a status symbol. This was not the case. Dr. Kantrovitz's team had done over 258 cardiac transplants in the animal lab, with survivors living beyond 2 years. Norman Shumway and Richard Lower, who pioneered the operative technique, had done even more, having first described the operation in 1960. If you are interested, I would advise you to read Professor Kantrovitz's excellent account entitled Moment in History, America's First Human Heart Transplantation, the concept, the planning, the furor. In Japan, there wasn't just criticism that followed their first heart transplant. Dr. Juro Wada performed the country's first heart transplant at Sapporo Medical University in 1968. His patient lived for 83 days. There was, however, a huge outcry. Ethical practices had not been followed, culture had not been respected. There were doubts about the recipient needing the operation and concerns about the independence of the brain death certification. Dr. Wada was investigated for criminal liability, and although this was later dismissed, deceased donation was outlawed in Japan for the next 30 years. But let me take you back to South Africa and Denise Darwell and her family. There are two things I would like to highlight: race and privacy. Mr. Darwell had also consented to donate Denise's kidneys. There was a 10-year-old boy, Jonathan van Wyk, who was also a match, but according to the South African racial classification at the time, was coloured or mixed race. Denise was white. This was the height of apartheid. He was also successfully transplanted. There's truth in the saying that when we're cut, we all bleed the same colour. The second kidney from Denise was not transplanted due to damage suffered during the accident. The liver was not transplanted because the surgical expertise was not available in South Africa at the time. The degree of publicity surrounding the first heart transplant was unprecedented. This is true for the first heart donor as well. I have told you all this information because it is in the public domain and serves to humanize the donation process. But it is not our practice to bring the spotlight to bear on families in their time of grief. They do not donate for the accompanying fame. Theirs is truly a selfless gift, honoring what their loved one would have wanted. Donation after death is truly altruistic in nature and must be treated with honor and respect. Organs must be allocated transparently and fairly to the benefit of all of humanity. The first heart donor was truly a momentous occurrence for what followed in terms of transplantation saving lives. This is true not only for the pioneering technical aspects, but also for the manner in which the donor was certified dead and consent was taken. There was no doubt it was done independently from the transplant team and to an exacting medical standard. Consent was compassionately requested, fully informed, and freely given. It is on these fundamental principles that deceased transplantation still rests.